There. Welcome to Freedom Chiropractic and Holistic Health. I'm Dr. Andrea Shanowski, and I wanted to take a few moments to, number one, tell you a little bit more about our office and the services that we offer, but I also wanted to go over some home healthcare tips. There's a lot of things you could be doing at home to speed up your healing process so that you can achieve better results and also faster results, which we all know we want that. So first I want to do is kind of go over some things, just a little bit more about our office and some of the services that we offer. So our office is a chiropractic and holistic health office. We focus on providing care for the whole entire family. That means we do treat babies as well as adults that are maybe have a lot of health problems or complicating issues. We also can help with patients that have osteoporosis or severe arthritis as well. Now, we do help with simple solutions. So people that are trying to get out of pain, people that are wanting to get back to the gym or back to work, people that are looking for just more energy to get through their day, people that are looking for help getting better sleep or actually sleeping properly. For moms as well as soon-to-be moms, we are also able to take care of pregnant women. We take care of and also check over baby and mom after birth happens, just to make sure everybody is off to the right start and everything is where it needs to be, so everybody can sleep and function at 100%. We also can help with more complex issues like people that are having digestive issues. Sometimes there's a combination of heartburn and reflux going on. Sometimes there's previous injuries or other health conditions you may have. So a lot of times we have to look and delve a little bit deeper into problem solving to figure out what the root cause of that digestive problem is. We also can help with hormone balancing. So for those of you that are dealing with issues with menstrual cycles that are irregular or menstrual cycles that are very painful, even if you've already been on medication or had surgeries done, for those women that are trying to get pregnant or who have been unsuccessful with any fertility treatment, sometimes there are some physical problems that could be going on that could also be complicating things for you. So we can look at everything from physical aspects to hormone imbalance issues, even looking at dietary problems that could be causing some issues for you as well. And for those of you that are trying to lose weight, sometimes, you can lose weight quickly, but it comes right back. So we want to help with long-term solutions so that you can, number one, get the weight off, but learn how to keep it off for good. Our mission in our office is to provide compassionate and affordable chiropractic and holistic healthcare in Peoria. We have clear expectations. We want to know, and we want to tell you what exactly is going on, what we can do in our office, what can you expect in our office. And we also collaborate with other local healthcare partners and providers to make sure that you have the best care possible. We all know that when you go to one specialist, they don't always talk to the other. We want to break that mold. So we want to make sure that we keep your primary care well-versed in what's going on for you. We want to make sure that you are able to get the best care possible. And sometimes that means we all have to be on the same page and communicating. So I am not afraid. And typically I do send out my initial visit notes out to your primary care to let them know what's going on. But if we have any further issues going on, sometimes I may need to call and talk to a nurse or a doctor in their office so that we can all get on the same page to get you results. One of the biggest things that sets our office apart is we actually take the time to listen to your healthcare concerns. We want to spend time with you to figure out what the root cause of your health concerns are. We want to make sure that we are providing a multifaceted treatment plan. That means not only things we can do in our office, but things you can do with your medical doctor, things you can do with your diet, with your exercise plan. And we also provide affordable payment options. Most of our patients find that, when they do start a care plan, they may have a lot of things going on. Typically, we can actually start to see some really big changes within the first 2 weeks. And some people have a huge change after that first treatment as well. So expectation-wise, like I said, usually the first 2 weeks, you're going to get some improvement in our office. Now, in our office, we do have a number of different services. I think a lot of people underutilize what we have in our office because they don't know what we do. So as you know, we do provide chiropractic services. We do gentle, non-rotational adjusting as well as instrument adjusting. So that means that we use our hands to do treatments. We have specialized tables. We have instruments, so we can apply very little force to do that adjustment. So it's comfortable if you have some nerve issues, arthritis, or if you're in a lot of pain. We actually have a table that will lower you down, so you're not having to contort yourself to get on the table for a treatment. In addition to that, we also do, I say, a little bit more flexible treatments for patients that are toddlers or children that are moving around. We kind of come to them. So we actually have a pediatric headpiece in one of our rooms that we're able to put basically over the neck. And then mom can hold baby as we do that treatment and making sure that we are getting the best adjustment and best treatment possible for patients of all ages and all sizes as well. Also, we offer physiotherapy exercises and a rehabilitation program. So that means that we do custom tailored exercise programs. Typically, that first visit when you come in, we do a full examination looking to see which muscles are not working properly, if there's any imbalances. And then we actually put together a plan for what we can do training wise here in the office to make sure that we rebuild those muscles so you get long-term relief. And a lot of times that means you are going to have homework exercises. So if you're willing to do those, you're going to see some great results in our office. If you're not doing them, number one, I'll know, but we're not going to get results as quickly as I would hope. So just make sure that you understand that when you look at some of the exercises and things we do in our office. We also offer holistic and functional health consultations, so we can help with things like dietary changes, kind of going over what you're eating and modifying that to help with the healing process. For patients that are looking at weight loss, we can kind of go over what your diet looks like, what might be missing, or some small changes we can make to help improve that. People that are having digestive issues, people that are having sleep issues, energy problems, hormone imbalance, we will sit down with you kind of going over your health history, your diet history, tests and surgeries you've had done in the past, and we will come up with a plan as to the things we need to address, and we'll kind of sit down and talk a little bit more about what those things are, where we're going to start, and we take it one step at a time. We don't want to do a million things. We don't want to do testing that is not necessary. We want to make sure we get answers and get you moving in the right direction to get rid of or start working on improving those things. So for that reason, that's why we sit down one-on-one and spend the time with you to really figure out what the root cause is. We also offer laboratory testing. So we have lab testing kits. Some of those are done in the office. Some of those are done at a lab draw facility. Some of those are home test kits where you take them home and you take the samples yourself in the comfort of your home. So you're not having to come in for, blood draws and things like that if we need to do those. And that just helps us to look a little bit deeper into the issues you might be having or some of the health concerns you have. We also have a full line of pharmaceutical grade nutrition and supplements. So we use everything from herbal as well as botanical blends to help make sure that your body and your organ systems are working properly and have all the support they need to heal and function and assist with your healing properties and functions as well. We also have massage in our office. So we will be having, and we have unveiled a relaxation room, actually will be happening here in January 2022 in our office. So after your massage or just a hard day, you can stop in and get a chair massage just to help relax the muscles and that sort of thing. We also have a licensed massage therapist on staff. So she provides everything from relaxation spa-like massage to therapeutic or deeper tissue massage to help actually reach a goal like improving mobility, getting rid of scar tissue. She also does Reiki massage as well as chakra balancing. So very well versed and kind of a lot of different things that we offer in our office. But we all know that why we're here tonight is really to get those tips so you know how to not injure yourself and how to make sure you're getting faster results. So we've got a couple things we'll go over. One of the first things is what to do following an adjustment. So after we do an adjustment, we're moving the bones, taking pressure off that nerve so your body can start the healing process. A lot of times the muscles and ligaments have a memory. So in some cases, if those muscles are used to being spasmed or tight, they can actually pull that adjustment out of place. Some adjustments can last for, an hour or two, and some can last for weeks on end. So it just depends on how your body responds to that. Typically after an adjustment, I do recommend walking around the office for a few minutes. Don't go sit down in your car and don't go for a long drive or anything like that. You want to walk around, let your body kind of adjust and settle into that adjustment. The other thing you want to do is making sure as much as possible that when you get home, we may have already talked about some positioning changes, anything from sleep to what you're doing or how you're sitting at work. We want to make sure that we're looking at those habits or looking at things that could be causing damage. So if you're sitting all day on a cell phone looking down, if you're sitting at a desk with poor posture, those things can definitely impact how long you hold your adjustment. So start kind of keeping an eye out for things that could be causing you to have extra pressure on those. Like I said, the top two things typically I see are sleeping positions and what you're doing at work, or if you're sitting in a car, or if you're sitting in a desk. Those things can definitely have a large impact on how long you hold your adjustment. The second thing I want to go over is when you should ice and when you should heat. So after an injury, when we have muscle spasms and swelling, we want to use ice to cool and calm everything down. If you have more chronic issues like, joint pain that changes with weather, or if you have arthritis in an area, heat works better for those. Or if we have muscles that we're starting to strengthen that are being overworked and kind of tightening up, usually I find ice works better for swelling or, new injuries. If we have more of a chronic condition or tension, heat works great to kind of get some blood flow in there to heal it faster. Other things you can use, a lot of people like to use those creams over the counter. There are cooling creams, things like Icy Hot, BioFreeze, Sombra, what we carry in our office. Those help with any type of muscle pain that's associated. So you can use those creams. You can actually, we have the Sombra here in our office. It's like a roll-on. You basically apply it on the skin. It soaks in to help the muscles relax and relieve any muscle pain that you're having. If you are having pain more related to degeneration or scar tissue or arthritis, some warming creams that have things like capsaicin or arnica in it, those ones, or even MSM, work really great to help kind of warm up the area, get it moving, kind of helping with that stiffness a bit. So that's some things you can do at home. Some other supplements that can help too. A lot of times, people don't realize this, but over-the-counter medications, things like Tylenol, ibuprofen, those types of things, typically can stop the healing process, and they stop inflammation, which is how your body knows how to heal. So typically, if you need those things, absolutely take, pain relievers if you need them, but there's some great options naturally that can assist with your healing process. One of the first of those is omega-3. Omega-3 or fish oil is a essential fatty acid that your body needs to repair everything. As an added side effect and bonus, it actually is cardioprotective, and it also helps reducing inflammation. So it's actually a strong anti-inflammatory. There are some heavier and more clinical dosages that can be used to help as a pain reliever rather than doing a Tylenol or an ibuprofen. Definitely ask me about that. There may be some contraindications if you're taking on other medication. So again, ask me about dosages for you specifically, and we can talk a little bit more about that. Another thing that can help is quercetin. Quercetin is a natural anti-inflammatory. It actually stops your mast cells from releasing inflammatory products and chemicals. So that can help to reduce any swelling or inflammation we have in an area, especially if we're dealing with a lot of swelling, if we're dealing with a lot of muscle spasms, that can be really helpful. And we have a product in our front that's called Allerade that has that quercetin with bromelain, as well as a couple other things to help reduce inflammation. And it also helps with allergy symptoms and inflammation symptoms. I've used it on everything from sprained ankles to bug bites to bronchitis at my house. It's really helpful for a lot of different things. Another product that can be helpful is high absorption magnesium. So typically when we look at magnesium products, you want to find a buffered form so that your body can absorb it very quickly and easily. Some people that have tummy issues may notice that there's different forms that work better for them. I will say to stay away from the magnesium oxide. It is worthless. You only absorb maybe 10% of that. So ideally we want to go for a magnesium citrate or a glycinate, which is a little bit more slow absorbing. We have a blended product called Triple Mag that actually has 3 different forms of magnesium. So it helps with slow absorption, fast absorption, and also electrolyte balance so we can get those muscles calmed down a bit faster. One of the other things that can be really helpful for you is vitamin C. Now, again, we got to know the right form here. So we want to look for a buffered form of vitamin C so that it is a natural form, not created and synthetic in a lab from corn-based. Typically, any of those vitamin Cs that are from ascorbic acid are synthetic made. They're derived from corn and are actually inflammatory. They're not going to help to prevent injury. So we want to make sure we have a natural buffered form of vitamin C that is not synthetic at all. So if you need help with that, let me know. Or we also do supplement reviews, so you can bring in what you have. We'll look it over and see if that's a good goal for you or a good product for you to take. One of the last ones that I want to talk about is glucosamine chondroitin with MSM. So glucosamine chondroitin can help your body to regrow cartilage and reduce joint pain. MSM is actually a joint pain reliever that is natural. There also are MSM creams, kind of those warming creams that can also be used, but you can also take those by mouth. Typically, you do need to take those for a long period of time, about 90 days to start seeing changes with that cartilage regrowth and with inflammation. So a lot of different things that you can do at home supplement-wise to help with the healing process. Another thing we want to make sure we're doing is getting plenty of water and electrolytes. So typically, when it comes down to it, we want to get about half of our body weight in ounces. So if you're 100 pounds, that's 50 ounces of water a day. But we also need to make sure we are getting salt, because our body takes water into our cells when there's plenty of salt for that water to move towards. So if you are not getting salt in your diet, or if we have some issues with electrolyte balance, so your body's not absorbing those, or if you have had issues in the past with diarrhea or any type of vomiting, a lot of times that can also reduce some of those electrolyte balance. So one of the things I recommend is typically 1 electrolyte drink a day or half a teaspoon of pink Himalayan salt, which has a lot of high quality minerals in there to help make sure your body's getting enough electrolytes. Another thing we can look at is foam rollers. Foam rollers can be really helpful to keep those joints moving. Now, if you've got a lot of muscle spasms, I would not recommend that yet. Typically, it may be a few weeks before you're able to utilize something like that at home to help kind of keep the joints moving. Another thing that can be really helpful for you is range of motion stretching. Range of motion is going to be basically going through the ranges of motion of your joint pain-free. So Like, for example, for your neck, you'd be able to actually bend your head forward, backward, side to side, pain-free, to start getting improved mobility. You can also do that same thing for the lower back. You would just bend forward, backward, side to side, again, pain-free to help improve your motion and mobility. Another thing you can do is those home exercises. So typically we go over some training exercises and stretches in the beginning, and then eventually moving to more strengthening and muscle activation, neuromuscular retraining exercises. So just make sure you're doing your exercises as recommended, because those are going to make a huge difference. Typically we have 4 layers of muscle in our upper back and our lower back. All those muscles have to work together and make sure they're working in the right order. So you want to make sure you're going through those exercises, and we'll slowly, as we retrain those, kind of graduate to the next level of exercises to make sure everything's working and on the same page. Another thing that can be really helpful are traction devices. So if you've ever seen those inversion tables where you hang upside down by your ankles, those can be really helpful because they can actually open up the joint spaces and we can rehydrate those discs. There are also cervical tractions that can be placed over a door frame in a doorway, and you can do traction that way. There are also some great ones that are on a table that you can lie on. There also are some posture pumps that can be inflated to help open up those joint spaces, kind of similar concept. So definitely, if you have any questions about that, if you have arthritis, if you have disc issues, those are tremendously helpful for you. But again, we might have to wait a little bit to make sure those muscles aren't spasming or fighting those treatments. So ask me more about that if you'd like more information. And then one of the most important things, like I said, those habits that we talked about. So when you're sitting, you want to make sure as much as possible that your back is upright in your chair and your back is against the back of your chair. So if your chair tends to lean back where you're tipped backwards, that's going to cause you to put more pressure in that lower back. So you want to make sure your back is upright. You want to make sure your knees are bent and your feet are resting on the floor. I recommend sticking out your bottom before you sit down and then kind of bringing yourself back over your hips. That'll help so that your weight is centered and we're not having more pressure on one side. Same thing getting in and out of the car. After you sit down, you want to lift straight up so that you kind of resettle yourself on your buns and making sure that that weight is not more on one side or putting more pressure on one SI joint as well. When you're standing, you want to make sure as much as possible, you want your ear directly over your shoulder. So you want to make sure you've got that nice posture, everything lined up as much as possible. So if you need more help with that, please let me know. Desk positioning, typically you want to make sure that your keyboard and mouse are pretty close to you. You want to make sure your monitor is high enough, but also close to you so you're not leaning forward. Again, if you're sitting at a chair, you want to make sure your back can rest up against it and your monitor is close to you so you don't have to lean forward. For those of you that do a lot of lifting, bending, twisting, whether you're working with kiddos at home or at work, you want to make sure as much as possible that you get in a squatting position. So you will bend at the knees and you'll bend actually at the front of your hips. So not at the back. We don't want to bend at our waist. We want to actually kind of stick our butt out, and then we want to make sure we're squatting down and bringing whatever it is you're lifting as close as possible to your center of gravity, which is your belly button. So you want to make sure you hug it close. And then to avoid twisting and avoid injuries to the disc, you want to turn your whole entire body rather than twisting just the upper half to help prevent injury. One other thing you want to do is making sure when you're using a phone, you're not, putting it between your neck and your shoulder there. As much as possible, you want to use hands-free, or if you're on the phone a lot at work, using speakerphone or a headset can also be really helpful for you. Typically, when it comes to beds, there's so many questions, and pillows. I hear so many questions about what kind of bed is the best bed out there. Really, it comes down to this. Everybody has their own thoughts and kind of desires for whether they want a soft bed or a firm bed. Typically, I find that you're going to want to aim more for a firm bed that is supporting your spine, but you do want to let your shoulders and your hips sink in a little bit. So I typically like some of the newer hybrid beds. One of the ones I really like is Sealy makes one called I think it's Bodypedic or Posturepedic bed. Those actually have springs on the bottom. They have a foam on top, and they do have a plush as well as a firm. I always say if you get a firm mattress, you can always add a egg carton or a foam on top to soften it. If you get one that's too soft, you're not really ever going to get support unless you put a board underneath it or something. So typically you want to aim for a bed that's firmer. I have had a lot of patients that have, reached for either the Sleep Numbers or the Tempur-Pedic beds. And honestly, I've seen those are just way too soft in my opinion. So if you are looking at a new mattress, definitely talk to me about what's going on for you. But I would definitely try out beds. Don't just order one online. Actually go into a store, try it out, making sure that it's the right density and it's going to support you properly. And if you need help, let me know. One of the other things is, again, pillows. You want to make sure you've got a nice arch in your neck. So if your pillow is, really thick and pushing your head forward, that's a problem. If you're sleeping on your side and your head's doing this, that's a problem. So you want to make sure your nose stays in midline with your chest and you've got a nice arch in your neck. So whatever pillow you're going to have for that works great. Typically those foam ones break down a little faster. So I usually recommend regular fiber fill pillows or some of the pillows that have quilting and things to help make sure you have that support throughout the night and throughout your sleep time. For those of you that are wanting to know a little bit more about changing positions, if you're having a lot of low back pain, especially going from lying down or sitting to standing, we want to make sure as much as possible that we tense up our core. So taking a deep breath and tensing up those muscles before we make that move can be really helpful. You can also, if you're lying on your side, you want to tense up those muscles, swing your legs off the bed, and then use your arms to push yourself to a seated position. That way you can get off the bed very slowly without injuring yourself or causing muscle spasms to happen. Really important to rest as well. So as we start this healing process, your body needs sleep and rest to actually heal. That's when you heal the most, is when you're sleeping. So make sure you're getting plenty of sleep. Depending on your age, that's anywhere from 6.5 to 9 hours of sleep. Those teenagers can need up to 11. So if they're staying up late, getting up early, might be time to rechange or swap around bedtimes a little bit. And just, again, make sure you're getting some rest, making sure your body can heal properly. When it comes back to, if you are going to be out there shoveling or doing yard work or whatever it is you're going to do where you might overdo it, we want to make sure that after you overdo it, after you get those muscles overworked, we want to use ice to calm them down. So the very first day after overuse, you want to use ice and rest. The next day, I usually recommend heat and stretching. And then the day after that, get back on top of your exercises so we know those muscles are retrained and back on track with you. If you are going to try a new activity or, again, getting back to doing something, I usually say you want to take it slow, about 20 minutes at a time, then do the ice, see how you feel later. If you can do another 20 minutes, great, but definitely make sure you're doing 20 minutes at a time with plenty of rest and ice breaks in between so you don't hurt yourself or re-injure yourself. So hopefully you learned something today. And if you have any other questions or would like more information about some of the services I shared with you earlier, please let me know at your next appointment. We can get you set up for a consultation on that. In the meantime, have a great rest of your day.